Some people, as I suggested, just can't seem to get into their bodies. And I'm sure you know this as clinicians dealing with chronic pain. You know, here you are giving people medications to reduce their troubled symptoms, and yet they still can't get to it. There are 2 pocket-sized machines, which are under $200, that are like biofeedback like instruments, which basically measure the parasympathetic and sympathetic drives and cue the patient with the motion of a light to do deep breathing, and then give them feedback with 3 different types of lights, red, blue, and green, whether they're in the relaxation zone or whether they're out of it. And what this does is just helps the patient have an extra nervous system to know that they're in that zone of relaxation. Now, some people who are very goal-driven will get very stressed because the red light, which is the sympathetic overdrive light, will turn on in the split second. And here they are, they're trying so hard to breathe, you know. And what I'd like to say is that's the natural course of life. Your body is constantly in motion chemically and neurologically. All we want you to do is get to learn how it feels in your body for 2 or 3 seconds when you get that light on. And you won't need this any longer. But you don't have to stay in there. The body, all the body needs when you're doing these activities is just that remembrance of what relaxation feels like. It doesn't have to stay in that state for 24/7. I think that's really important to suggest to people because they get too goal-driven. And then it just becomes a stress instrument. Here's another study looking at hypnosis for chronic pain. And basically what was interesting was they were able to improve the outcome, but that the results were enduring even a year after the study had finished, which I think is even more interesting. You know, remember when we looked at that split brain and we looked at all the tracks of information going to the cerebral cortex and less tracks going back into the limbic system? When a patient is in a trance, they can be in a trance, by the way, even with their eyes open and talking to you. What's happening is there's another communication, a nonverbal communication going on during that during a hypnosis interval. And I think maybe this is a great way to bypass resistance in having someone do hypnosis. If you're really sensing as a clinician that you're having a lot of trouble getting people to that sense of relaxing. Another study looking at guided imagery, which is a sense of using visual cues and your imagination to enhance the relaxation response, showing a beneficial effect in women with chronic interstitial cystitis. We're coming to the close of the lecture, and I'd like to say that you, through the website, can direct patients to learn about breath work, learn about centering and grounding, guided imagery, and biofeedback on our website. This is the website URL. Every single one of these things, these little self-training programs, is free. So if you do nothing else, print this out and hand it to your patients. We spent several years through private small grants putting together some of this information on the web so that people could just use it. And we've had really positive feedback from our patients. So in summary, we've taken a very long road at looking at stress and some of the integrative elements that you already actually implement in your practice and reevaluate them. And what we've seen is there is a bit of evidence for some things, not a lot for others. But enhancing the patient's involvement in doing lifestyle management is extremely powerful in enacting a more effective therapeutic plan, and especially in the regards of managing chronic pain. Thank you.